One of the things that patients describe sometimes when you find and press on their prostate is like a sudden urge to feel like they have to urinate.
Oh, really? So if you need to pee, then you found the pee spot. Hey everybody, I'm JC Mendoza and welcome to Uncomfortable Questions, where I get to ask questions of a doctor about things we're all dying to know but are a little too embarrassed to ask. And with me, as always, is Dr. Peter Stahl. He is a board-certified urologist and a nationally recognized leader in male sexual medicine. And I'm glad you're here because the people, they seem a little lost, okay? And I think that they could really benefit from some G-Pete-S, if you will.
All right.
All right?
Where are we going?
We are going to the P spot, doctor.
Okay.
All right, first of all, what is it?
That is a fantastic question. I'm really glad you brought this up.
Yes.
Because this is kind of a new area of sexual medicine that honestly has not received enough attention. It's been like a very kind of heteronormatively focused field, and it's nice to see that we're kind of starting to move away from that. The P spot is named the P spot because of the prostate. That probably is not the right name for what we're trying to get at, which is really an erogenous zone that is accessed through receptive anal intercourse or receptive anal sexual play of some sort. And I'll tell you why calling it the prostate spot is probably not the right thing. But that's what we're talking about. We're talking about why does receptive anal intercourse feel good? And like what's going on there? And it's a really interesting question, right? The first thing is a lot of people that don't have prostates, like women, get a lot of sexual pleasure from receptive anal sex.
Right.
So like what it looks like is that there are branches of something called the pudendal nerve. That is the nerve that is responsible for all of the like feel-good sexual sensations that you get from sexual activity, right? That's the nerve that goes to the head of the penis, the clitoris, the rest of the penis, the inside of the vagina, and it has branches, and a lot of people that go in and around the anus and the rectum. And it's probably the branches of those nerves that are responsible for like the P spot, right? So somebody who has a lot of nerve branches around their anal sphincter, that might be their like erogenous zone and the source of pleasure during receptive anal sex. For other people, it might be in the anterior, which means like towards your face or the front of your body, not the back.
Okay.
The anterior rectal wall, kind of over here. And you can see why that might be mistaken for the prostate, because that's actually very close to where the prostate is, right?
So P might not stand for prostate, but can it stand for pleasure in this instance?
I think it can.
Pleasure spot, I like that. So let's say that I wanted to try some new things, right? And let's say someone out there, anybody wanted to be a little adventurous with some P-spot play. Is that something that they could do by themselves, like solo?
Yeah, absolutely. People can use their fingers, they can buy a sex toy, they can buy like specific sex toys designed to access the prostate, which may or may not be what they're really doing, but like prostate massagers, stuff like that. And yeah, I think until you've tried that, you don't know where your particular P spot is,
for sure.
whether or not you even have one, right? So go for it.
So is there any trick to finding the P spot?
Yeah, so during a prostate exam, which I do in my office, often one of the things that patients describe sometimes when you find and press on their prostate is like a sudden urge to feel like they have to urinate.
And you mentioned something earlier about pleasure centers like P spot, P for pleasure, and a very specific type of zone. I can't remember exactly the word that you used.
Yeah, the word I used was erogenous.
Erogenous zone. Can you tell us a little bit more about those?
Yeah, so erogenous zones are the places in the body where the nerve endings that are responsible for sexual pleasure are kind of concentrated. So these are the areas in the body that, when stimulated, can result in sexual pleasure. So the classic erogenous zones are the head of the penis, the shaft of the penis, the clitoris, the vagina, the nipples, right? So there's, those are the classically considered erogenous zones. But anatomy's complex, and there are clearly erogenous zones that vary between people that are in and around the anus and the rectum also.
It's like a whole nother world out there.
Yeah.
Or in there, actually. It's a whole nother world in there that I didn't even really know too much about before we sat down.
I'm glad I can enlighten you, man.
Thank you so much. I appreciate all your help as always, and thank you for the geography lesson, teaching us where things are. And I feel confident in saying that our next stop is the P spot.
All right.
Or the Dr. Pete spot.
Maybe.
All right, and if you guys want to come back to the Dr. Pete spot, feel free to like, subscribe, comment, and follow for more content. Thank you.